Most of the time, our cats don't need an emergency vet, but sometimes waiting and hoping that they'll feel better tomorrow can be a dangerous mistake. The difficult part is knowing the difference. Cats are very good at hiding pain and weakness, so when a cat suddenly looks very different from normal, I pay attention. One of the biggest red flags is difficulty breathing. If your cat is breathing with its mouth open, struggling to breathe, stretching its neck, or working hard just to get air, don't wait to see if it passes. Breathing problems can become life-threatening very quickly. This is an emergency. Another situation I would never ignore is being unable to urinate. You may see your cat repeatedly going to the litter box, straining, crying, or producing little or no urine. This can be especially dangerous in male cats because a urinary blockage can become life-threatening. If you think your cat cannot urinate normally, don't assume it's constipation. Get veterinary help immediately. Then there are the sudden neurological changes. If your cat collapses, cannot stand, suddenly becomes extremely weak, loses consciousness, or has a seizure, this isn't something to watch at home. Keep your cat as calm and safe as possible and seek emergency veterinary care. Serious bleeding is another obvious emergency. If your cat has a major wound, is bleeding heavily, or you see blood and vomit, urine, or stool, contact a veterinarian immediately. The same goes for serious injuries, such as being hit by a car, falling from a height, being attacked by another animal, or suffering a suspected broken bone. And don't forget about poisoning. Cats can accidentally ingest medications, toxic plants, cleaning products, pesticides, or other dangerous substances. If you know or suspect your cat has swallowed something toxic, don't wait for symptoms to appear. Contact your veterinarian or an emergency veterinary service right away. And never make your cat vomit unless a veterinary professional specifically tells you to. Some substances can cause even more damage when they come back up. What about vomiting or diarrhea? A single mild episode isn't automatically an emergency, but repeated vomiting or diarrhea, especially when combined with weakness, blood, severe pain, or a swollen or painful abdomen, is much more concerning. Here's the most important thing I want every cat owner to remember. You don't need to diagnose your cat at home. You just need to recognize when something is seriously wrong. If your cat suddenly can't breathe, can't urinate, collapses, has a seizure, is severely bleeding, suffers major trauma, or may have been poisoned, don't wait for tomorrow. Call a veterinarian or emergency animal hospital. Your cat may not be able to tell you, "I need help," but sometimes their body is saying it very clearly, and recognizing that moment could save their life.